Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. PSVT treatment, that is, stands for the Paroxysmal Supraventricular Tachycardia. So let's look at its treatment regimen. So first we have the hemodynamically. So in terms of hemodynamically stable regular. So hemodynamically stable regular or the narrow QRS tachycardia or the narrow QRS tachycardia. So this will result in the vagal maneuvers. Then comes the IV adenosine as well as the IV verapamil or the diltiazem. To watch the full video, please click on the link below and it will redirect you to the main video.